Hello everyone, I am Dr. Samir Vohra, Director of the Illinois Department of Public Health, and I'm here to reflect on World AIDS Day. This year's theme is World AIDS Day 35, Remember and Commit. 2023 marks the 35th World AIDS Day, and it is dedicated to remembering those we've lost and renewing our commitment to stepping up prevention and treatment of HIV, eliminating the stigma and inequities surrounding it, and ultimately to ending the public threat from this disease. Now, we've come a very long way in the care and treatment of AIDS since December 1st was designated as a day of international observance in 1988. As we pause to remember those we have lost over those years, we can also celebrate the scientific progress, the unceasing determination of the advocates who have fought for enhanced government resources, and the increased societal support for this cause. Despite the progress, we can also acknowledge much more work must be done to ensure the advances we've achieved are available and accessible to all who need them. Here in Illinois, under the leadership of Governor J.B. Pritzker, we are fully committed to this fight against HIV/AIDS and to deliver on the ambitious Getting to Zero Illinois initiative aimed at effectively ending the HIV epidemic by the year 2030. The Illinois Department of Public Health, and especially its HIV/AIDS section, continues that work by funding services related to the prevention of HIV, as well as services for Illinois residents currently living with HIV, and our robust programs for pre-exposure prophylaxis known as PrEP for Illinois, and the post-exposure prophylaxis program. PrEP is a highly effective preventative tool and can reduce the risk of getting HIV through sexual activity by an incredible 99%. IDPH has partnered with 16 local health departments across the state to provide PrEP for those who could benefit from it the most. I am proud to say that since 2030, our spending on PrEP has increased sharply and reached $3 million in state fiscal year funding in the state fiscal year 2023. Additionally, the Illinois Department of Public Health oversees spending through the Ryan White Part B and AIDS drug assistance programs, ensuring that people in Illinois who are living with HIV can access the medication and services they need to stay healthy, regardless of their ability to pay. We work with organizations around the state to make sure this money goes where it is needed the most. While we don't yet have a cure for everyone, HIV today is easier to treat and control than ever. Today's antiretroviral medications can suppress HIV viral loads so powerfully that people living with HIV are no longer infectious. We also recognize that to achieve health equity around HIV, we must address the disproportionate impact of HIV on Black Illinoisans. That is why IDPH, in partnership with both the Chicago Department of Public Health and with Black-led organizations across the state, have partnered around an initiative called Thrive to support those Black-led organizations that provide HIV services in the state of Illinois. The long-term goal of this initiative is to ensure Illinois-based Black-led organizations grow, thrive, and continue to serve our communities. We know how vital it is to support Black-led organizations that are on the front lines of this fight, and I'm proud to say a total of $5 million has been granted to a dozen of these organizations during the current grant cycle. On this World AIDS Day, IDPH remains steadfast, continuing to prioritize efforts aimed at ending the disparities in access to prevention, treatment, and care that have hampered our efforts to conquer HIV/AIDS. The route to reaching our ultimate goal of getting to zero in Illinois is to continue to listen to and work with you, our partners in this fight. On World AIDS Day, let's remember and commit, and we appreciate all you do to build brighter futures across the state of Illinois.